After the OCR announced the Rights of Access initiative in early 2019, they started investigating complaints immediately. However, some in the industry were slower to comply. Medical care is a large and complex system. Changing processes or re emphasizing priorities takes time and can often lead to confusion and errors. 3 years after the initiative was announced, some trends across violators were starting to reveal themselves. Some agencies lacked the infrastructure to easily comply with these requirements. Some administrations didn't have formal procedures to comply with. In addition to investigating and issuing violations and fines, the OCR had helped guide some organizations. Finally, many systems had failed to train their workforces appropriately. Announcing the initiative made it clear that the OCR was serious about emphasizing rights of access. By September of the same year, previously mentioned Bayfront Health was investigated and fined $85,000 for violations, the first post announcement violation of its kind. The OCR doesn't discriminate toward any medical provider. They have investigated hospitals, medical and mental health providers, multi specialty clinics, academic medical centers, and nonprofit institutions. As of December 2021, there were 25 total violations on record, the costliest being Arizona's Banner Health, a 30-facility network, which was fined $200,000. When the results of the investigation and subsequent fine were announced, then OCR Director Roger Severino stated, "This settlement signals that OCR's Right of Access initiative is still going strong and that providers of all sizes need to respect the rights of patients to have timely access to their medical records." Another lesson learned is some organizations lacked sufficient infrastructure when it comes to providing fast and efficient service for patients' records. Some facilities, especially large or complex ones, need to have much better methods of communicating and producing records accurately and quickly. Not every organization had these. In fact, some networks didn't have formal processes in place to provide records that had been requested. Without a formal procedure, it would be extremely difficult to meet these demands consistently without error. Many of these violations come from providers taking too long to produce the records, with many taking months even after repeated requests. The OCR has shown a willingness to provide technical support in many cases, as the goal is and always has been to provide quality patient support. However, they will not continue to work with repeat offenders if agencies show an unwillingness to adopt corrective actions.